Ladies and gentlemen, welcome to the Digital Times Green Pavilion. We are very happy today in this afternoon here in Dubai. We have a session called Transitioning Sustainable Healthcare. We all know that climate change will influence every aspect of your life, especially the healthcare system. And this year is the first year that we have the Health Day. And then I'm very glad to invite, we have totally 4 speakers, including me, to share with you how to reduce the climate impact in the healthcare sector. I will show my slide, this one. Okay. So we're very, very happy that we have Oliver Gröne. He is the CEO of International Network of Health Promoting Hospital and Health Services. And the second, Oliver will be the second speaker, and Ramon will be the first speaker. He is the Executive Director of Healthcare Without Harm Southeast Asia. And I will be the third speaker. I come from a hospital. And then Karmen, as primary care physician, will be the last speaker. She is a family physician, work in Dubai. And I'll briefly introduce to you how do we approach and then to reduce healthcare climate impact. You know, we are facing the climate change, the challenge of climate change. And there are at least 2 A. One is the awareness, the other is action. Awareness, and this is according to the social ecological model. So if we want to change anything, that we should not only approach through a single aspect. We need to have ecological consideration, such as from the macro side, we have like international UN, this is international WHO, WONCA is the World Family Physician Organization, or Health Promoting Hospital, International Hospital Federation. And this awareness is very important. And how do they do to increase the awareness for the international and national level? The macro level is that they have to set up some policy, some standards, some accreditation. And the meso level is the institutional level, such as hospital, clinic, healthcare specialties, and their action should, in the institution, they should have some policy, and then set up some committee and give some education. And for the individual level, this awareness, the awareness of individual levels, such as healthcare professionals or a patient in the healthcare setting. And the action should be like for healthcare professionals, like prescribing the medicine, which is not that greenhouse gas effect, not that big. And then diet or transportation, how do you use public transportation, try to reduce your transporting carbon footprint. So we are very happy to invite all the speakers from different level to talk about how to reduce the carbon footprint of healthcare sector. The first one, I would like to invite Mr. Ramon San Pascual. Let me introduce Ramon. Ramon is currently the Executive Director of Healthcare Without Harm Southeast Asia. And he was graduate from Public Health School in Washington University, Seattle. He brings with him years of experience working in civil society organization, CSO, engaged in social development work, and has dedicated many years on policy development, advocacy, and working with policymakers and stakeholders on population, health, environment, and sustainable development issues. He served as the Executive Director of Healthcare Without Harm Southeast Asia since 2015. He aims to lead as in the annual report said, pursue its vision to transform healthcare in Southeast Asia into a green and resilient sector so as to protect public health from climate change, one that leverages healthcare leadership and purchasing power so as to drive policies and market towards sustainability. The floor is yours, Ramon.
Dr. Lin, good evening from Manila, and to all our participants, both online and in Dubai. Let me share my screen with everyone. I prepared a brief presentation that will just open up our discussion today on transitioning towards sustainable healthcare. I hope you can see it.
Yes.
Let me just bring you over to the journey of Healthcare Without Harm as a global organization, a nonprofit organization that has been tackling climate and health for at least almost 9 years now. But the first thing I want to share with you is when we assisted the World Bank to develop their own guidance on climate smart healthcare, we didn't realize that we ourselves later on will release certain pioneering literature, research, and survey that will define further how hospitals will be able to intervene in the climate crisis. In as early as 2017, we already have defined certain elements or certain dimensions of what will be known later on as climate smart healthcare. This includes health system design of models of care based on appropriate technology, building design and construction based on low carbon approaches, investment programs in renewable energy, and waste minimization and sustainable healthcare waste management. These are just some of the more basic elements of what would become a mainstream term in 2023. And congratulations to all of you in Dubai, because we're able to monitor great progress in the sphere of mobilizing healthcare towards mitigation and adaptation within the healthcare sector itself and in relation to the other sectors. So after releasing that study together with the World Bank, in 2019, our organization released a healthcare climate footprint, which is the first ever research done together with a group on how exactly healthcare contribute to the climate crisis by measuring emission in hospitals, in health systems across countries of the world. And you will see there a piece of description that will tell you who are the biggest emitter in terms of the healthcare system, and who are those that are not as big healthcare system but can also emit big time or a big contribution in the world, in the global emission of healthcare systems. Now, the healthcare carbon footprint report, it right away established that almost 5% of the global net emission comes from the healthcare sector. And this is now a highly quoted literature, a piece of document that indeed brings the whole issue of the climate crisis into the healthcare sector itself as the center of healing, and yet we're also bringing and causing climate change and climate-related disasters. So with that, afterwards, we are also released now what we call as how do we guide hospitals towards reduction of its own carbon footprint along the agreement, the climate agreement signed way back and especially reinforced in 2015. So in that review now, this is the global roadmap towards decarbonization of healthcare. We were able to define 7 high-impact actions that will gradually reduce emission in healthcare system along the 2050 target of the UNFCCC. The first action, for example, relate to renewables, meaning that hospitals have to abandon depending on fossil fuels and move fast towards renewable and healthy sources of energy. And I think this was reiterated in the COP28 with that statement coming up from different healthcare leaders across the globe. It also refers to buildings because overall hospitals as a set of buildings could contribute 17.8% gigaton in terms of carbon emission. It also refers to travel, to food, pharmaceuticals, and other key steps, including paying attention to procurement. What is the buying processes taking place in healthcare systems? And the 7th step is already on delivering effective healthcare services. So from that initial World Bank report and then towards the admission that healthcare system contributes big time, almost 5% of global emission, to presenting a prescription on how do we mitigate healthcare systems and what are the key steps or the 7 strategic steps. I want now to bring it over what healthcare without harm is actually doing. One is through the Global Green Healthy Hospital Network. And Dr. Lin is as a prime leader of the GGHH in the Southeast Asia, being a founding member, in fact, chair of the Regional Coordinating Council of the Global Green and Healthy Hospitals in the Southeast Asia. Now, the GGHH is founded on what we call as the key sustainability goals that expands chemicals, waste, energy, transportation. But the key that we think would be critical to transform the healthcare towards sustainable system is the leadership inside hospitals, inside Ministry of Health, inside the different organizations and associations of various medical professionals. So guiding the agenda now, using the agenda, these hospitals that I mentioned, 1,600 members, now in over 80 countries, are gradually journeying towards greening and developing climate-smart healthcare facilities all over the world, including in the countries being managed by the Southeast Asia Office of the Healthcare Without Harm, in our own region in Asia, particularly East and Southeast Asia. From this point onward, and we are now looking towards 2024 onward, at the post-COP 2028 scenario, we sense that there's a lot that we can take home from the gains in Dubai. And 2024 will be a banner year in terms of further climate action in healthcare systems and healthcare facilities within the Ministry of Health, coordinating with the WHO, working with thousands of hospitals in the Southeast Asia region. We will be inspired by this vision statement that we will mobilize our ethical, economic, and political influence to create an ecologically sustainable, equitable, and healthy world. This is our global vision as well. But particularly, we are determined to fulfill our own mission in the Southeast Asia. And this is the new mission statement that we will carry out beginning 2024 and many years onward. We champion people's right to health in a healthy environment, leading healthcare sector transformation in the region towards climate resilience, decarbonization, and sustainability. So, fed by the gains and informed by the many agreements to be brought home from the COP28, we would want to foresee this vision and mission beginning 2024 in such a way that as an organization, how do we contribute in the transformation of healthcare? We would see, we can already visualize that by 2029, we have accelerated the progress of the healthcare transformation in our own region via partnership, platform for collaboration, and policy advocacy. So we are preparing, organizing ourselves, our partners, various hospitals, working with the different ministries of health and other sectors and key leaders among healthcare professionals. So these are the programs that we will pursue based on the strategies of partnership, platform, and policy advocacy. Now, for my last slide, Dr. Lin, I just want to be guided in concrete steps, concrete actions, because again, we are moving forward with the many gains from the COP28, the very first time that there is such thing as Health Day, and where there are many health ministers that came, and that there is a health ministerial declaration that was put forward. So we are proposing the following set of actions in our own region. One, we need to follow through with the different ministries of health that attended that sent delegation in Dubai to translate the commitments they made to national climate action, leading the entire healthcare sector. I think this will be a huge leadership jump 2024 onward with engaging the different ministries of health. We would want to continue with the vulnerability and climate baseline assessment, not only of hospitals, individual hospitals, but this time around healthcare systems across our own region, helping the MOH and helping the WHO and mobilizing the member hospitals of the GGHH. We need to pursue various ways of financing climate and health transformative agenda from the very budget of every government to mobilizing different foreign partners, donor agencies, and development entities, including multilateral banks, ADB in particular. And we would keep on advocating for sector-wide policies while collaborating with other sectors for more meaningful health outcomes. Meaning, healthcare sector must work with various societal stakeholders. And finally, we should continue to educate and mobilize the health sector on climate and health to deepen the understanding and pursue broader set of action coming up from the healthcare sector itself. Thank you so much.
Thank you, Ramon. I think that this year is the first time that we have the health day. It means that healthcare will be very valued by all the other delegates, presidents, and then there's so many healthcare leaders come to Dubai. Then we may discuss something that healthcare can do, not only reduce the carbon footprint of the healthcare sector, but also we have to prepare the possible challenges that we will face. Thank you. So please can show your share. And the second speaker.
Let me try to cut again my sharing.
The seating, you touch the seating and then you can cancel your. Okay.
Thank you so much again.
Okay. So the second speaker I would like to introduce is Professor Oliver Gröne. Okay. Professor Oliver Gröne is the CEO of the International Network of Health Promoting Hospital and Health Services. HPH is a renowned international NGO working not only on treating disease, but also health promotion. Since 2010, HPH in an environment task force started. Professor Oliver is also the vice chairman at OptiMedis AG, a company focused on health improvement. He specialized in developing systems for monitoring healthcare quality and implementing intervention to enhance population health, emphasizing practical application of scientific method for significant societal impact. He holds advanced degrees in public health and has trained in health services research, quality improvement, and biostatistics at renowned institution. Professor Gröne is a professor at the University of Witten-Herdecke. He cooperates with national and international leaders advising on healthcare quality issue. So Oliver, the floor is yours, please.
Thank you, Minan. Thanks for the introduction and greetings to everyone in Dubai and on the screens around the world. I hope you can see my slide.
Yes.
Okay, so let me just briefly introduce the organization that I'm representing here today. So I'm here with my role as CEO of the International Network of Health Promoting Hospitals and Health Services. This is a network that was established more than 30 years ago by the World Health Organization based on the ideas put forth in the Ottawa Charter for Health Promotion, which identified settings as a key place to promote health and to implement health promotion. And hospitals, or the healthcare sector as a whole, was seen as one of those settings that creates health, or where health can be created, similar to settings such as schools or cities or other parts of the environment. But healthcare settings are very specific, and this is why a project and then a network was established to promote the idea that healthcare services should not only provide the best acute medical care or chronic care, but possibly take more consideration of the comprehensive needs of patients in helping them get informed about disease, navigating the system, and providing the support to actually behave in a healthy way and to create settings that promote such healthy behavior. So you can see on the screen the definition of what health promoting hospitals and health services stand for. And that's a definition that was updated just last year. And the last part, which is highlighted here in a different color, to support sustainable societies, was added as a very important part of our definition, because as we've just heard from the previous speaker, healthcare systems have an impact on the environment, and therefore we also see it as our role as a network to address this environmental impact. The numbers of members are changing basically on a daily basis. We have now 22 national networks and about 600 members worldwide, with 30 countries being represented, most of them either in Asia or in Europe. So I referred to this already. We do build on the settings approach from the Ottawa Charter. Health is created and lived by people within the settings of the everyday life, where they learn, work, play, and love. So a lot of our work is aligned with the Sustainable Development Goals. Its whole system focus is holistic, it's multidisciplinary, and we're strongly building on partnerships to implement our work and emphasize community participation, partnerships, empowerment, and equity. And this brings me to the topic of my today's presentation. This network also stands for not just the implementation of projects to improve the health of patients, the staff, and the community, but it also stands for complete transformation of the system towards improving health gain. And I will say more on that in a moment. So I think what we can hopefully agree on today is that we already have a lot of tools in our hands to reduce the environmental and the climate impact of health and healthcare services. So there's a huge number of evidence-based examples to reduce the climate impact of health services. And Healthcare Without Harm is actually a very good source of these examples. And I'm delighted to be in the session today with the co-speakers, and particularly Dr. Ming-Nan Lin, who was the chair of our first working group on healthcare and the environment within the HPH network. And as part of the work of the task force that Dr. Ming-Nan led, a number of standards were developed to address the environmental impact of hospitals. Now, for the HPH network, we have a broader vision that reflects on a lot of opportunities for health promotion. And 2 years ago, or 2.5 years ago, as we were in the process of revising our overall standards, we were delighted to incorporate those specific standards addressing 7 areas of action for the organization to address the environmental impact and to address climate change as part as our overall standard set and as our overall self-assessment tool for hospitals. And as you can see, there are a number of areas that were just mentioned a moment ago by Pascual, Dr. Pascual, particularly around the use of fossil energy or recycling or transportation, but you can also see areas such as the eating habits, green building principles, and toxicity and volume of waste. So these are clear statements that you can read up in our manual about action areas where healthcare organizations should act now, because there's already such great evidence of impact that can inform your implementation strategies. But the broader picture is that when I'm talking to hospital managers and medical directors, often question is raised, do the strategies to improve let's say to reduce the climate impact, do they have a relationship with the quality outcomes? Is it possible to reduce the climate impact while improving quality? And the evidence on that is pretty clear. Speaking here to an international audience, some level of emission given the current facilities is unavoidable, and there needs to be strong investment in such facilities to reduce the greenhouse gas emissions. The key point of this slide, though, is that while some low-income countries have a low composite score on healthcare access and quality, while also having a low greenhouse gas emission impact, as countries invest in healthcare systems, the greenhouse gas emissions are currently increasing, but only up to a certain level, and then it flattens off. And once you've reached that threshold point, with further investment in facilities and further increases in greenhouse gas emissions, there's no further increase in access in quality. The lesson that we can learn from that is, first, even beyond the threshold value, we need to reduce emissions in the healthcare sector and bring it to zero as much as we can. But as we move above the threshold value, we need to be more intelligent in our way in which we design healthcare systems, in which we also use facilities and build facilities, because sometimes building a green facility is not the right decision, but rather not building it at all, because in many high income systems, we have huge excess capacity or capacity that could be utilized in different ways in order to bring down the emission values much more significantly than by applying green building systems. And why is that? Those that are working in the healthcare sector or health service researcher in particular will be well familiar with the Choosing Wisely initiative. Choosing Wisely is an initiative driven by clinicians that have identified many clinical areas of action that are not evidence-based. So one example is unspecific low back pain and a clinician ordering a CT scan. The CT scan is responsible for a high number of emissions, but in many cases, it's not indicated as a diagnostic device. And Choosing Wisely has generated long lists of such interventions or diagnostic or therapeutic recommendations that are not evidence-based and that could, in many cases, be postponed or avoided. The point is that many of these ineffective low-value care interventions are responsible for a very high number of CO2 equivalent emissions. In addition, we have a situation where, on average, 1 out of 10 persons admitted to a hospital experiences some level of harm, some patient safety accident or event. And these events also contribute to a large number of CO2 equivalent emissions. So if we only focus on the green section, the effective care, further improving the effectiveness of care will increase the opportunities to reduce the climate impact, or phrased differently, will reduce CO2 equivalent emissions. And as you can see on the left-hand side of the slide, the buildings, electricity, gas only account to about a quarter of the emissions, where the actual clinical care and related procedures account to 3/4 or 80%. So reducing harmful care, reducing low value care is actually a huge opportunity to reduce the climate impact. So the key conclusion is actually to think about care pathways, not buildings. And this is taken from Healthcare Without Harm's colleagues' report on the healthcare climate footprint. And you have seen these numbers about the different scopes. And actually the clinical care with its scope 3 procedures is responsible for a very large number of emissions. Colleagues from the Sustainable Healthcare Coalition have actually developed a tool to think about pathways rather than buildings. And if you think about a patient with diabetes in this case, providing care at the lowest level possible through effective primary care practice can avoid patient travel and can avoid inpatient admission and bed days. And this will then also reduce the climate impact along the whole care pathway. So thinking about a pathway will open our eyes to move away from just spending and investing in facilities, but reflecting on a whole new system of care where perhaps digital consultations, family clinician consultations will have a much bigger role, and overcapacity in building sites could be reduced. We've built such a tool in the German system by modeling the CO2 impact of whole care pathways by identifying for different procedures components of a care pathway, such as primary care, elective hospital care, surgical care. We've then used routine data from social health insurance, which is available in Germany, to identify how many diagnoses, how many GP visits take place, or how many hospital days. And we've then used emission data from the literature and from available databases to establish the overall CO2 impact of a care pathway. So modeling care pathways in such a way will really provide a lot of ideas on having a significant reduction in CO2 emission in the healthcare service. And just one last example from another study we've conducted in Germany about hospitalizations from nursing home. These are very frequent hospitalization over a weekend because of lack of GP capacity in the nursing homes. Nursing home residents are admitted over a weekend to the hospital for a diagnostic test or for a diagnosis. And these nursing home admissions are very, very frequent. We have about 220,000 avoidable nursing home resident admissions to the hospital just in 1 year in Germany, and they account to 768 billion euros cost. However, they also account to 29 million kilograms of CO2 emissions that could easily be avoided by providing better and more effective care closer to the needs of the patient. So in conclusion, there's a lot that we can build on in the healthcare sector, particularly on the excellent work done by Healthcare Without Harm, but also bringing the work of Healthcare Without Harm closer together with the work done in health service research and quality improvement, and by taking a broader lens, not just focusing on a facility, but actually the patient needs and the patient care pathway, we can build a new healthcare system that is providing better care, is safer, and has a much lower impact on the environment. Thank you very much for your attention.
Thank you, Oliver, Professor Gröne. Yeah, it's very eye-opening that if you improve the healthcare quality, not only improve the health of the patient, but also reduce the climate impact from the healthcare sector. So yeah, it's very good, very eye-opening. The next one is me, because previous two speakers, starting from NGO, international NGO, from the health, from the advocate for reducing the climate change, Healthcare Without Harm International Organization. The other is HPH, Health Promoting Hospital and Health Services. And so I work in the hospital, so I would like to share with you what we have done in the hospital. I now serve as the Vice Superintendent in Buddhist Darin慈济Hospital, and also the President of Taiwan Vegetarian Nutrition Society. And just as Oliver said, that I also chair now the HPH in an environment task force. So I would like to share with you my experience from the point of view in the institution, building an environmentally friendly hospital. As both speakers say, that healthcare sector, there's so many things that will related to climate change. The first one is that healthcare sector use a lot of natural resources, such as the building should be 24 hours air conditioned. And then it also produce a lot of toxic waste, such as biohazard waste. There's so many disposable equipment. So there's so many waste that were produced by the hospital in the healthcare services. And then healthcare sector is supposed to be the health knowledge center. And we all know why, the reason, the risk factor for people get sick. And there are a lot of people needs the care of healthcare sector. There is a statistic talking about the most trustworthy profession in the world. Among the 10 leading trustworthy professions, there are four professions are from healthcare: nurse, doctors, pharmacists, and paramedics. So as you can see here, we doctor need to think about why nurses always better trusted by the people. And then UN, as you know, that the COP is now 28. So the international organizations such as United Nations has speak about so many years. We need to take actions to mitigate the carbon dioxide emission. And then UN also have developed 17 goals to transform our world. Like as you can see, SDGs, climate action, is number 13 SDGs. But all the SDGs is linked together. As you can see here, summary of the 17 SDGs linked to the 5 areas of critical importance: people, planet, prosperity, peace, and partnership. This is from the British Medical Bulletin Journal in year 2017. It says that we should partners with all that makes the planet habitable and ensure that all people enjoy peace and prosperity now and in the future. If we can work on the goals of the 17th Sustainable Development, that through the 5P critical aspects, that maybe we can really enjoy the peace and prosperity now and in the future. So this is the relevance of health goal and other goal. As you can see, goal 1 is end poverty. If you are poor, the health condition won't be that good. And then the goal 2 is end hunger, achieve food security. It is related to health. Goal 4, goal 5, goal 6, goal 16, and then other goals. So all the SDGs are interrelated, and health is quite important because health is the utmost concern of the people. And Wonka, I'm a family physician, primary care doctor. Wonka also has a working party on prenatal health, and it develops and publishes some document and guideline for the primary care physician to follow how to reduce their carbon footprint during their daily practice. And as you can see here, International Hospital Federation, their themes in the year 2022, the theme is global learning, local action, sustainable healthcare. So there are so many international healthcare organizations that has been talking about the importance of healthcare sector get engaged in reducing the climate impact from the hospital and other health services. And in Taiwan, we developed HPH, the development of HPH in Taiwan in the year 2017. The first time we put the energy saving and carbon mitigation in the accreditation standard of healthy hospital, and we revised it in the year 2021 climate action. Just as like Oliver said that we have the standards, and we need to let every hospital knows how to do the action is very important. So I would like to share with you from an institutional level. The first one is that we need to have this kind of committee and this kind of top-down support of the policy. So in Taiwan, in our hospital, we have committee for health promoting hospital. As you can see, health promoting hospital focused on patients, staff, community, and also environment. And then I will just briefly introduce what we have done to reduce the climate impact in our hospital. In our world, this is from a dialysis unit, hemodialysis unit. As you can see here, there are 9 recycle bins here. Because we have foreign helpers, we have helpers from foreign countries. How can we help them to segregate all the recyclable correctly? So in the hemodialysis unit, we put different languages of different country and also the pictures on the recycle bins, so that the foreigner who cannot understand Chinese Mandarin may segregate the recyclable correctly. And their recycle bin in the whole hospital campus, different material will be recycled correctly, so it can be used correctly. So we have eco-friendly design environment. This is a trail. We call it health trail. We decorate the health trail with pictures, and also we put some informations on the stairs. As you can see here, we call it improve the environmental awareness. So there are ecological photos, and then as you can see here, we put the information about cut down watching TV for 1 hour. It will reduce the carbon footprint for 0.96 kilogram of CO2. And then we are using also the digital technology. We have a LiveBot app called Darling Go Green. As you can see here, we invite our colleagues to join the LiveBot. And in the LiveBot, on a daily basis, if you have some actions, you can just click it, such as you don't use plastics, you turn off your lights, you turn off your computers, you didn't take the elevators, you eat a plant-based diet, or you recycle papers or cups, or reduce water use, and then reduce paper use, and you walk more. All this can transform into the carbon footprint equivalent. So you started from a small, the seeds, which can grow into a trees. So we at every actions different carbon footprint. So if you didn't do that, then it's like you are growing the trees. So after 21 days or after 42 days, then how big is your tree is. This we call feedback and gamification. We started from the year 2021, and with a voluntary basis, we invite our colleagues. So as you can see here, in the year 2021, there are 217, it's only 9% of our staff joined the Darling Go Green program. But in the year 2023, it increased to 477, and it equals to 24% of our staff. And then we also calculate how many trees, how many carbon dioxide reduced. And then until 2023, the data is still pending. But for 2021, 2022, as you can see, we just like plant 900 trees. And then the second year, 2022, is we plant more than 2,400 trees. We also provide a walking step counting maps in our hospital campus. You can go how many steps you can count. If you have like the target of 10,000 steps one day, then you can exercise, and you don't use car, you don't use a motorbike, so you can reduce your carbon footprint. And we calculate the distance, the steps between our hospital to the train station, and also to the nearby university, Zhongzheng universities. We provide this kind of walking step counting maps. So for our staff, they can not only exercise but also reduce their transportation carbon emission. We are now trying to do this in COP26. I saw the restaurants, the menu in the restaurant. As you can see here, not only the price of the dish, but also the carbon footprint. Pasta is £9, but it only 0.3 kilogram CO2 emission. But if you eat Scottish beef burgers, it accounts for 3.9 kilogram of CO2. So this is also the awareness. We are trying now how to label this kind of dishes, this kind of meals with to our staff, and also try to persuade our government to do this. And then we provide only plant-based diets in the whole慈济hospitals, not only慈济Hospital, but also慈济University,慈济TVs, and all慈济foundations. And we had to make it delicious. So we also provide our staff the recipe to cook delicious meals. Not only that, when the contractor provides services such as Starbucks, if they want, because there are so many patients and their families pass through the hospitals. So it's a good business if you can, like Starbucks can open their store in the hospital. So as you can see here, we have Starbucks in Taipei and also in Taichung慈济Hospital, but they have to serve vegetarian snacks only. So we create a friendly environment. We calculate how many tons we reduce the emission of CO2 by providing plant-based meals. In the year 2018, we provide more than 3,600,000 meals, which equals to about 2,800 tons of CO2 emission. Not only that, we didn't provide disposable utensils. All the stuff we carry the reusable utensils. So we calculate in 12 years, we save more than 5 million pairs of chopsticks, which are equals to more than 20,000 kilograms of waste reduced. And this is a green building. That is what we do from the beginning, from the construction of the hospital. We use a green building design. So the nature light in the lobby and in the corridor. And we have many greens in the hospitals. We call it garden within the hospital and hospital within the garden. And this is so-called heating environment. So our patients came to the heating garden, not only enjoy the greens, but also can feel happy. And we have also some solar panel and roadmap, but as you can see here, we have so many solar panel, but it accounts for like less than 5% of the electricity, because hospital building is one of the within the most energy consuming buildings. So this is Taichung慈济Hospital. Their solar panel energy can generate 240,000 kilowatt hour, which equals to 129 tons of CO2 a year. And then this is within the hospital. Besides what we have done in the hospital, we also cooperate with Healthcare Without Harm. We hold climate impact checkup tour training workshop on April 10 and 11 in Taipei. We invite 25 hospitals, 40 participants, try to tell them, educate them how to start take the carbon footprint in the hospitals. And then we also, as you can see, Oliver, in the slides, in the pictures, we hold every year. We hold the green the seminars about reducing the hospital's carbon emission. This is this year in Vienna in September. So we have been doing this since the establishment of the hospital, but we believed if we want to walk far, we have to work together. And then not only the buildings, daily practice, and also daily living. What do we have to do our best to reduce our carbon footprint? So as you can see here, we have dye technology can produce so many things that is you from the recycled plastic bottle. Okay, this is what I from the perspective of an institution. We have the committee, and we have some program try our best to reduce the carbon footprint from a hospital. Thank you. The last but not least speaker is Dr. Karmen Long. She was trained in the University of Aberdeen and worked in Inverness as a GP specialty trainee until 2019, led the UK to embark on a journey of humanitarian services in Mozambique. She spent 7 months in 2020 in Mozambique as a volunteer doctor for慈济Buddhist Foundation before returning to Malaysia to work as a GP in慈济refugee-free clinic for another 6 months. Currently, she served a full-time family medicine consultant in Dubai and part-time second-year student in Master of Public Health in Edinburgh University. During her volunteer work in Mozambique, she witnessed the disaster caused by cyclone, which is a result of climate change. So the floor is yours, Dr. Karmen Long. Your mic should be mute. Your mic is mute. Okay.
Right.
Please.
Can you hear me okay now?
Yeah, I can hear you.
Excellent. Thank you, Dr. Lin, for the introduction. I'm Dr. Karmen. I am a primary care physician working in Dubai. Today, my role here, I'm very, very grateful to be part of the panel to share about the impact of climate change in terms of healthcare in the angle of Mozambique. The reason that I'm sharing from Mozambique, for anyone who's unfamiliar with Mozambique, it's in the east coast of sub-Saharan Africa, and it has a very long coastline, and it covers multiple countries' borders, which takes up to South Africa, Zimbabwe, Zambia, Malawi, and Tanzania. These used to be a great advantage for Mozambique itself when it has all these borders around the country. It served as a transport mode for any inland requirements from the port. But unfortunately, over the last 10 years, these economy advantage of having the long coastline has become a disaster attraction. With this 2,700 kilometers of long coastline, it has been turned into vulnerable areas that is being deeply affected by climate change. A bit about Mozambique. This is a country with 32 million of populations, where about half of them still live in rural areas in very frugal conditions, and 90% of the country depends on agriculture. As this is the case, the population is very dependent on the climate change, as agriculture is very climate sensitive. Unfortunately, they have been, because of this supposed to be a geographical advantage, has turned them into the vulnerable country. And in 2021, Mozambique has been ranked as one of the number one most vulnerable country to climate change. One of the main reasons is because of the rising sea temperature and also the rising sea level, and they are in the coastlines, and most of the land is low-lying land. So in the last actually 40 years, it has been recorded of 53 natural disasters just in 40 years. And that means that it's average of at least one natural disaster is happening in Mozambique itself. Now, bearing in mind, Mozambique is one of the poorest country in the world. And with these numbers of disasters happening, it puts them into a very difficult situations, as there are endless numbers of recovery that they are having to go through every year. Looking at this data, we're seeing in the country that is so vulnerable what is happening over the last 20 years. the number of storms happening, if you look at just the red bar, we can see the number of red bar is just in inclining mode. And for the last 5 years since 2019, every year there is a cyclone coming in, and they are not just rains, but it all brings into floods. So from 2019, Cyclone Idai, Cyclone Kenneth, Cyclone Eloise, Cyclone Gombe, and this year again, Cyclone Freddy. This is not just disasters for the populations. It's also very difficult for NGOs and the governments, because we are never ending in acute disaster relief. We have never been able to enter a proper recovery phase, because there are always an acute event that we have to provide immediate release. We have seen even our own volunteers, families that have been going in and out into resettlements area just because of repeated numbers of cyclones. The reason that I'm speaking about Mozambique is because I was involved in Cyclone Idai back in 2019. And this was recorded as one of the most devastating cyclones in the last decade. It has brought a very heavy rainfall and overnight, and causes about at least 1,000 people who have died from the event, and over 3 million people being affected. Up until today, there are still thousands of people living in resettlement center who are waiting for housing and a proper shelter. There are thousands of students who still do not have a proper school because of recurrent, repeated episodes of cyclones that stopped and affected the recovery project. A photo on the right side is demonstrating how students at the moment are still studying. After the cyclone, they were put into a shelter, and the recovery project is still ongoing. So schools, roads, buildings, they were all damaged. And for a country whose infrastructure is already at the lower side, it takes them a lot of effort in order to rebuild. This is a place that has really filled my heart, and I felt compelled to share the problems that people are facing in Mozambique. I have had personal encounter with the students, with children, with patients who are all deeply affected by repeated events of cyclone. I'd like to take you through just what happened in 2019 in Cyclone Idai, and how it had affected the local population.
Just stay in the middle.
The water levels have dropped so quickly now that this is actually becoming a much more dangerous trip. You could see just tracts of muddy brown water. This is one of the most impoverished areas in the world. How were these hundreds of thousands of people across these areas going to cope? They don't contribute anything like the developed world to issues of climate change, and yet they bear the brunt. The water was upwards of 8 meters high, so water would have been right up towards the top of these trees. WFP had set up a distribution centre, and this was in a village which was on higher ground. When we arrived, there were thousands of people, from small children to grandmothers and grandfathers, who were desperate. Becky, you can smell that? We were shown by one old lady the crop that had survived this cyclone, which was a mouldy piece of corn. That was it. How was she going to feed her family? If we are to believe the climate change scientists, it is likely that areas like Mozambique, Malawi, Zimbabwe will see more extreme weather events going forward, not less. These communities need help to become more resilient. These are people who get very little help on a regular basis. As long as they have survived this initial phase of Cyclone Idai, they will survive. You can see that in their eyes, but they need an awful lot of help.
Yes, these are the innocent people who are bearing the consequences of climate change. They are the group of people who contributed the least to carbon's footprints, carbon emissions. However, they are the group that suffered the most from the impact of climate change. They probably don't even know what climate change is, and they probably don't understand about carbon emissions, yet they are the ones who are being deeply, deeply affected. In terms of the impact of climate change on healthcare, as a physicians, I think there are a few things that we need to look into, how these are being affected. We all know healthcare itself and food security are deeply connected with each other, and climate change, one big issue is affecting the food security. Talking of food insecurity in Mozambique, prior to disasters happening, they are already facing difficulties in raising their livelihood. In Mozambique, maize is the main crop, and it accounts for up to 72% of small medium farming unit. In Mozambique, as I've mentioned earlier, in the central to northern part, which is low-lying land, the cyclones are affecting these areas, bringing flood in central to north Mozambique. We have done surveys in southern Mozambique, where it's closer to the South African border, where the farmers have been telling us that the irony fact that in the southern part they're not getting enough water and they're entering into drought. We revisited areas that is just pure grassland, and we're told that these in 5 to 10 years ago used to be a maize farm, but now it's no longer growing crops. These are affecting them deeply. These are the stories that we were not aware of until we walk into the communities. On top of that, fisheries on the coastal lines, this is one of the main animal source protein that they are getting, but unfortunately with repeated numbers of cyclones, they are not getting the source of protein that they are supposed to get. The Food and Agriculture Organizations has predicted a 5% decline every year because of cyclone. And we see this in our eyes, that this was a farm of our foundations where volunteers were working on it. And during the time that the water was filled in the river, in a few months later, when summer hit, then the lands were just completely dry. And after that, it just never recovered. So that is the problems that it's not just periodically, it's actually a lot of areas were becoming very dry and not suitable for living, and they have to look for another farmland. Food insecurity, it's a big problem that has lead to long-term consequences, as we all know. But I'd like to just focus on two main topics here, which is malnutrition in children and the female health in children as well. Malnutrition is a major issue in Mozambique because it's one of the poorest country, and securing food has been the hardest things for everyone, especially living in the rural area. Malnutrition is one of the top 5 causes for under 5 children mortality, and currently we're still seeing over 40% of under 5 children who are chronically malnourished. This is not just affecting them currently right now after the event, whereas this is a long-term impact. On the photos on the right, we're seeing the one on the top is actually taken in a resettlement center. When they were put in resettlement area, the government do not have enough food to supply them, and an entire family were only given a plate of shima, which is maize flour mixed with water. On the bottom part is those who have recovered from the acute stage and now in the resettlement center. So in the recovery stage as well, they are again still lacking food, and they are in an entire family relying on shima, which is maize flour pudding. So these are the long-term impact. We're seeing not just children, adults who are chronically malnourished. This has a long-term consequence on children. It was going to impact their school performance if they had the opportunity to go to school. It has a long-term detrimental effect on brain development, and that is going to cause them into older adulthood, that they will get poor physical health, which then takes them into the cycle of poverty that they're unable to get out of. Now, on top of that, female health is another crucial point to discuss. On the left is a photo of Thelma, who is, if I believe, I think she's about 7 to 8 years old, supposed to be in school when we visited the community, but we saw her carrying water. And when we asked her why is she not in school, she just told us that she has duty from her mother, that she needs to go and collect water. We see female being the first being sacrificed in the family when household income becomes a trouble. Female children were removed from educations, and in extreme cases, which are not rare in Mozambique, that in exchange of money, in exchange to support the family, in order for the family to be fed, young girls were being married off to older men prematurely, and even call us into sexual activity. Now, this is very saddening because at this stage, they're supposed to be in school, or at early teenager years, they're supposed to be getting education and not into marriage or having children. Female being in the younger age in marriage have a higher risk of gender-based domestic violence, and also they are put into a higher lifetime risk of infectious disease such as HIV, HPV, cervical cancer, hepatitis, etc. What is more worrying is that a young premature female, when they get pregnant, the pelvic structure anatomically is not fully developed, and therefore it put them into a higher risk of maternal complication, and is one of the reasons why in Mozambique and a lot of sub-Saharan country we're seeing a high maternal death still prevalent in this region. As a female, personally, I felt deeply disheartened learning this fact, knowing that I was privileged enough to get educations and be able to have food and educations and become a doctor, but whereas female children in this country do not get an opportunity because climate change is putting them away from that. Of course, there are other worrying things like communicable disease. If these two photos are not copied from the internet, these are the photos that we have captured in our missions. Children are barefooted and they are living in very frugal conditions. These are also young children who are trying to get water to support their families. So we see that these are the reasons for rising numbers of diarrhea, vector-borne diseases, and that's why they are the survivors are low in the under 5 children. Well, thankfully, this is now becoming an alarming issues around the world, and then we are acting towards it. The government of Mozambique are paying attention to it, and there are mitigation strategies. And COP28 this year has amazing approval of the Loss and Damage Fund, which is an amazing initiative that will be supporting Mozambique, country like Mozambique. But I think there are more that we could do as a physician, as what Dr. Lin has said as well, that we are one of the most trustworthy professionals, and we hold the responsibility to educate the populations of what is the truth in the world. Choosing this photo is because that this was one of the photos I've taken and that has moved me the most, because I've never seen the joy in a child's eye seeing a bowl of noodles, the desperate need of food. It's shown in the children in Mozambique, and I think we as physicians has a role in educating the world about the global food shortage problems. We all know that global warming, it's part of it is contributed by animal culture, animal agriculture, and animal farming. We know that food, it's actually, if we want to distribute all the food to everyone in the world, we're able to feed the entire population in the world. But because part of it is being taken to feed animals and then to feed humans, and hence resources were not distributed evenly. A pound of beef is produced by 12 pounds of grains and 1,000 liters of water. And what does that translate into? So 12 pounds of grain actually gives you 12 loaves of bread, and 12 loaves of bread would mean 12 families having food in Mozambique. 1,000 liters of water means 3 years of clean water consumptions for one person, and that will save a lot of families in Mozambique. I think we as a physicians has a role to educate not just ourselves, but our patients or anyone that we have been able to be in contact with, to share with them the story of how Mozambique, a very vulnerable country, is being impacted by climate change when they do not contribute to climate change. So if you have ever felt sorry seeing the pictures of a starving African, if you have ever felt compelled to donate, please have think about and be mindful of the food that we are taking every day. Actually, every day, just by what we are eating, we are able to support our families, our people who lives in the sub-Saharan Africa, who do not have a choice but suffer. We are one. We are no different from them. Looking at their smile, looking at their face, they deserve the basic human rights they deserve. So let us all work together as physicians together to look at how we can improve the lives of the others and how we can help them to mitigate the risk of climate change. Thank you very much for your time.
Thank you, Dr. Long. Yeah, it's quite sad that we see those people suffer most. Actually, they produce the least carbon footprint. So we are talking about inequity, health inequity. Okay, so it concludes the whole speeches today. So is there any question from the audience? No, so I would like to have some questions for our speakers. I would like to ask Ramon. See the Ramon. Okay. Ramon, are you still here?
Yeah, do you see me?
Okay. So I would like to ask you about we know Healthcare Ram is a very renowned international NGOs, which has been working on reduce the climate impact of healthcare sector. Do you have any information system that can help the hospital to adapt for stock taking and reviewing their carbon footprint? Can you show us? Because you work with UN, WHO, and then develop a lot of guidelines and also some materials. So can you share with us?
Yeah, we have certain tools and techniques both to mitigate our climate footprint in health in hospitals, as well as address, for example, difficult segment of our carbon footprinting, such as procurement. We've been running the what we call as the climate checkup tool, which is a way to measure carbon footprint in hospitals, as well as able to reduce the emission and plan it out, and be able to take case based on the capacity and where carbon footprint is heaviest within the operations of a hospital. This is being taught by our trainers across the globe. But I think, Dr. Lin, you've been part of the training done both in Taiwan, even in Singapore, but we have done this as well in Indonesia, in the Philippines, in Malaysia, and soon we will do it in Vietnam as well, and then in Thailand early next year. The point being that there is a distinct tool online that you can use both offline or online, whether in a spreadsheet or you stock your data in the cloud. But there is this tool already being used by many hospitals across the globe for over 3-4 years now. just to measure the carbon footprint and reduce the emission in healthcare setting, and we call it the checkup tool. Now, why is this useful? Not only that it can help individual hospitals to mitigate its climate footprint or carbon emission, but as well, it helps now the Ministry of Health, just like what we will do in Indonesia, as well in Laos, wherein the efforts of the individual hospitals is being matched by the system intervention being initiated from the top by the Ministry of Health, or even being assisted by the WHO. So we call it as a top-down approach, where this is where transformation happens, which we've been envisioning, that we showcase hospitals how to do it. MOH adopt a policy to accelerate transition, and in such a way that hospitals and healthcare systems in these countries are able to contribute actively, for example, in fulfilling the NDC pledges of countries within the context of the UNFCCC. So that's one clear tool that we are already using and is still being taught in many hospitals and countries in the world, but particularly in our region in Southeast Asia. Thank you.
Thank you, Ramon. Yeah, you can check. So if you on this webinar, you can check the Healthcare Without Harm websites. There are many guidelines, many tools that you can use for static the carbon footprint in the hospital. The climate impact check tool is the one of the best. Oliver, are you still here?
Yes, I'm here.
Okay. Oliver, thank you for your eye-opening speech. May I ask you that, as you know, that hardware improvement is not that hard, such as the building. You can change the building, improve the energy efficiency of air conditioner. But for software, that means change the behavior of healthcare professional. It is not that easy. So have you think about some strategy or some way that can persuade the healthcare professional? Because your study is very persuasive that the daily practice of health professionals, it means a large portion of the carbon footprint is from the daily practice. So is there any further recommendation or strategy you can recommend to the healthcare professional?
Yeah, thanks, Mignon, for the question. It's a very good question. First, I don't believe that changing the hardware is always easy. I think you gave a good example of what is quite easy in principle, such as renovating a building and looking at energy efficiency. That is principally that's easy unless you start running into some financial problems. Hardware, however, is also more challenging to redress when you look at pathways, because we're looking at a long-term planning perspective. It's not just to make one building energy efficient as it is now, but it's actually anticipating the type of care that will be needed in 10 years and to take decisions of whether to build a new hospital that costs €500 million, or actually emphasizing existing structures and investing more into primary care and specialist care in an outpatient clinic and video consultations and vice versa. So I think the hardware also has some challenges when it comes to a long-term investment perspective. But particularly as it is challenging, it's important to make this case whenever we are thinking about long-term investment decisions in healthcare, because I think it's a new perspective really to look at healthcare delivery design. But your question was more about the software. And there, I think you're really spot on. I think the software is really difficult to change. And we've seen that in a lot of implementation strategies over the last decades. And, you know, I've used to work a lot in quality improvement research, which is often about introducing small changes in protocols, in procedures. And it's very, very difficult to get professionals adopting these changes. So in response to this difficulty, a whole new field of research has emerged, implementation science. And implementation science looks exactly at how do we implement a system, a behavior, a process. What does this process depend on? What kind of contextual factors? What kind of data do we need? What kind of training? And I think when we are talking about climate change strategies, and I think Karmen, you also made that point very clear, is that we need to address any kind of change through this kind of implementation strategy lens, and we need to adapt or adopt all kinds of recommendations that we are seeing from implementation science. In fact, there's now the last couple of years a new thing called de-implementation, to take things out of the system that we've been doing, because that is even more difficult than learning a new procedure. It's more difficult to actually unlearn it, and take it out of the system. So we're talking about de-implementation. The good news is, though, that there's a lot of research on how to address that in the context of quality improvement. So what I'd like to see is that from a climate change perspective, we adopt these findings and try to de-implement any kind of procedures or activities that are bad for the environment, that could be reduced without causing harm to the patient, and actually having a win-win situation in the same process. And again, I think that's, for me, one of the positive notes is that there are a lot of overlaps and win-wins by putting together climate change strategies and quality improvement strategies and strategies that foster health promotion. They are often very similar, and they work towards the same goal. And by working together, I think we can have an impact.
Thank you. Oliver, you always bring some new concepts, implementation science and de-implementation science. Yeah, we hope that we can learn from you more, especially adopt the climate change, how to reduce the climate change impact. The last question, but we have only 3 minutes left, so I would like to ask Dr. Long. You, as a primary care physician with experience serving in the natural disaster damaged country, what do you think digital technology can help? Because the resources not enough. So is there anything that the digital technology can help?
Actually, digital technology is amazing. It's brought tremendous changes over the last year. So from 2019, when we first get involved, people were clueless and they were struggling to get help. But as we get involved in the with the local community, and then we supported them with phones and very simple smartphones with Wi-Fi, with SIM cards. With this, they are able to engage more with the external countries. And also, like during COVID time, when we are unable, majority of us are unable to travel, these communities are able to get in touch with the world with knowledges. Even getting the initial warning of the climate, the changes. So before that, like in 2019, when cyclone happened, it was middle of the night, and these people do not have any access to phones, and they do not know what was happening. So when flood came, there was a surprise. But whereas now with technology, we're able to have community leaders in the communities who carries a phone. And with that, they know that they need to pre-alert the other members in the community. They need to let the villagers know. And therefore, it actually helped a lot of us to prevent the not as bad as when it was in Idai. So we have took a lot of people out of home to go to the resettlement center earlier. And also during COVID time, as you remember, Dr. Lin, we were having collaborations with Darling Hospital. That was also provided a great exchange of knowledge, exchange of ideas and informations between two different countries to learn from each other and spread awareness as well. So I think technology plays an important role, even in healthcare in rural areas or in a poor country. So it's really, I would say, life-changing to have technologies in this area.
Thank you, Dr. Long. We would like to help. And thank you for all the outstanding speakers from Germany, from Philippines, and from local Dubai. Thank you very much. That we time is up. So thank you. Hope to see you soon. Bye-bye.
Thank you.
Thank
Bye-bye.
you. Thank you for the opportunity.
Bye-bye.
Thank you. Bye-bye.